everyone. We haven't updated anybody in a few days.
Like and subscribe.
So 2 days ago on Monday, we met with the the liver surgeon, and he was running an hour and a half behind, so we were there for a long time.
4 hours.
But then he was really awesome at explaining everything, and so he agrees with the oncologist that we need to do the immunotherapy for about 3 months at least, and throughout that time they may be doing more PET scans, possibly an MRI, or he did order an MRI.
I have to have it done within the month.
Yes.
He wants to see me next month.
So he does have to get an MRI done.
He wants to see how bad, or he wants to see different stuff that he has questions about.
Yeah. And so we're on our way to the immunotherapy, the first treatment right now. And anyway, the liver surgeon said he thinks that him and the colon surgeon could do the surgeries together. So that would be nice to have that all done together. I know it's not going to be nice.
It's
nice.
funny.
I'm sorry. My wording's off. I'm tired. So, the colon surgeon appointment yesterday got rescheduled to the 23rd because they had to go be in surgery. So that was kind of disappointing because we really wanted to find out information from them. That's where the tumor started. But anyway, the liver surgeon also said that it is good that the tumors in the liver are 2 centimeters. He said that's small, and there's a chance, depending how Charlie's body takes to the immunotherapy, if it does its thing in shrinking, there's a chance that he may just have to go into the liver and do an ablation instead of removing parts of the liver. And he explained also that if they did have to move like a section of the liver, because I was like, well, doesn't the liver grow back so you can take 80% of it? You just have to leave 20%. And he said it does grow back, but it doesn't grow the same way. So like if you take the left side, then the right side will just make up for the left side, so you'll never have the left side back, if that makes any sense.
Yes.
So what they try to do is take minimal amount because they may have to down the road go back in. So
nope, I was not texting and driving. I would never ever do that.
I'll finish your text.
So irresponsible. On a video,
Stop it.
there's evidence.
So I've lost where I was.
Talking about the liver growing.
Yeah, so they may be able to just do the ablation instead of removing it. So that's good news, but we won't know until time goes on with the treatments, and the immunotherapy is every 3 weeks.
And they want me to check it after my second cycle.
Yeah, so that'll be in 3 weeks.
Yeah.
I know there was some more stuff. He did say, and I mean, he can't really speak for the colon surgeon. I know they've talked about Charlie, and he said there's a chance they may have to take the right side of his colon. But again, we won't know until we see what happens with immunotherapy. And he did also say, because he showed us the PET scan like piece by piece, it was really cool, him explaining everything, and we were able
to showed us the lymph nodes, and
yeah, showed us the lymph nodes. They did find through the PET scan that there is a spot up by his aorta on a lymph node. It's really small, and he said that they wouldn't be, him and the colon surgeon wouldn't be the ones to remove that, and that it's so small that immunotherapy is probably going to make it be where you wouldn't be able to see it anyway. Like, as of right now, he said even if a surgeon went in there, they may not be able to see where it's at. So, but they are going to watch that. And there was something else. I can't remember now. It's just so much information, and it gets overwhelming sometimes. Do you remember? Do you have anything?
No, you got it. You do it.
I can't remember.
People ask me, and I'm like, yeah, he said it's gonna go good.
And Charlie's really nervous about
About shitting on myself, throwing up. Yeah. A little bit. Like, do I sleep on a bag now, or what?
I mean, when we did see, they have some diapers at the store for men. They looked pretty cool. I mean, they looked like gray boxers, so...
Yeah, they did.
I mean, you can always sport those.
Sure did.
So, yeah, it's...
I'll just take my chances shitting on myself, thanks. I'm not there yet. Not in life. No. It's going that way pretty quick, but I'm not there yet.
Yeah, so get this first immunotherapy done. I'm gonna try and do some video while we're in there.
But we don't know because there's other people.
Yeah, well, I wouldn't get anybody
We
else.
could just go ahead and go, does anybody want to be a star?
So yeah, this is awesome that we're going to the first treatment, and please continue the prayers, especially that the immunotherapy does what it's supposed to do, and that there's minimal side effects and no complications. And yeah, we just need to get it all shrunk and be able to get everything out of there. The liver surgeon also said he would probably, when he goes in to do the ablation or to remove part of the liver, whichever ends up needing to happen, that he's probably going to also remove 13 lymph nodes at least. We won't know until we talk to the colon surgeon if or how many lymph nodes the colon surgeon would be removing. And other than that, everything's kind of just up in the air, and now just the immunotherapy and then the test to see that it all shrunk, which you said that's going to be after the second treatment. They're going to do one to see what happened.
In 3 months.
Okay, they'll check in 3 months, but what's after this next
Cycle?
Yeah, after the second cycle, you said something.
Oh, no. Yeah, no. After the second, so in 6 weeks.
Yeah.
They're going to check. Wait, I don't know. Because the oncologist said 3 months. And he said second cycle.
Yeah.
So I don't know. They need to talk.
It's just a lot of info. Like, we have notes and everything written down, and it's just a lot of information. And between that and the books that we're reading, it's a lot. But yeah, so we will update after the therapy appointment. I'll try and do some short videos while we're in there and kind of share what immunotherapy is like, what it looks like. It's going to be, from what we're told, the same way as somebody going in and doing chemo, where it's going to go in through the IV, and they said that it is going to make him cold because the medicine going in is room temperature. And I think they said the actual medicine going in, the infusion, takes like an hour and a half. I believe. But when we first get there, for every treatment, they draw your blood, and then you go back out in the lobby or the waiting room.
And they make you something for your blood. Like, they make you your own special. They don't make the immunotherapy treatment until you get there. Until they see your blood, then they make it for you.
Yeah, and you have to wait for the blood results too, because if anything's off on your blood, then you can't do the treatment.
Well, no, they have to change it somehow.
Okay. So, and then they start the treatment, which is about an hour and a half. And in the treatment room, they've got it set up for, you know, the patient and the person that they bring.
And we're missing work today, both of us.
Yeah.
Again.
But they have warm blankets for him. They try and do whatever they can. They have snacks and everything. So that's pretty cool that they make sure that you and who's with you are comfortable. And we brought some of our books to continue reading. I think that's about it, though. So we'll probably be there about 4 hours, maybe more. And yeah, just keep the prayers coming, and we appreciate everybody's prayers, and we appreciate donations.
Our 65 subscribers.
And our donations that we've received on GoFundMe. That's going to really help with time off work and time off that's going to be coming with surgeries and, you know, the treatments. We don't know how he's going to feel tomorrow, the next day. But anyway, we will do another update, and thank all of you. Bye.
Bye.